A novel bedside swallowed optical sensor for detection of upper gastrointestinal bleeding. Gastrointestinal bleeding is a common emergent condition accounting for 7 to 8% of acute medical admissions. In the United States alone, upper GI bleeding leads to an average of 300,000 admissions per year and has a mortality rate that can reach up to 15%. EGD represents the mainstay diagnostic tool for suspected upper GI bleeding. However, timely EGD can be a challenging resource to access during non-business hours. Thus, a novel swallowed bleeding sensor was developed to facilitate triage of patients with suspected upper GI bleeding. The bleeding sensor system consists of a disposable swallowed optical sensor capsule and an external receiver. The SOS capsule is a minimally invasive single-use device designed to detect blood in the stomach. Detection of blood in the stomach is used for evaluating the presence of upper gastrointestinal bleeding. The SOS capsule features an optical sensor which detects blood and wirelessly transmits data to the external receiver. The capsule detects the presence of blood by measuring the absorption of multiple wavelengths of light. The data is then processed by an algorithm to determine if blood is present. The capsule is designed to withstand the mechanical forces and chemical environment of the digestive system, and thus will make its way through the GI tract and is then passed naturally from the body. Please note that at the time of publication, the SOS capsule has not yet been FDA approved and is limited to investigational use only in the United States. The external receiver collects and displays real-time information gathered by the SOS capsule. The receiver interprets the data and displays a result message of blood detected or no blood detected. We will now demonstrate the capsule administration and recording procedure. Patients with suspected upper GI bleeding are approached and consented. The SOS capsule is then checked to make sure that the optical sensor is flashing. The external receiver is then powered on and a patient ID is entered. The receiver will then indicate to remove the SOS capsule from the tray and pair it with the receiver. The patient is then given the SOS capsule and instructed to swallow it with 150 ml of water. The patient is then instructed to lie on their left-hand side and to remain in this position and avoid any sudden movements. After confirming that the capsule has been swallowed and the patient is lying on their left-hand side, the recording procedure can be initiated. Monitoring time is at least 5 minutes, but can last up to 10 minutes. The external receiver will then indicate whether or not blood has been detected by the SOS capsule. The recording is then terminated and the capsule is disconnected, and the patient can resume their normal position. 2 clinical case examples are presented. In the first case, a 38-year-old male patient with a history of recurrent upper gastrointestinal bleeding presented to the emergency department for hematemesis and coffee ground emesis. He was hemodynamically stable and was instructed to swallow the SOS capsule, and total monitoring time was 5 minutes and 13 seconds. The external receiver indicated that blood was detected by the capsule. The patient underwent an EGD after 1.5 hours of capsule administration, which confirmed our results. Large varices were found in the lower third of the esophagus, and an active spurting varix was seen at the GE junction, actively pouring red blood into the stomach. A total of 6 bands were successfully placed. On follow-up X-ray performed 3 days after capsule administration, confirmed that the capsule has been excreted from the body. In case 2, A 69-year-old female patient with a 2-week history of melena and progressive weakness in the setting of severe anemia presented to our department. The patient was on aspirin and dipyridamole for a history of cerebrovascular disease with stroke, but denied any previous episodes of GI bleeding. Similarly, the patient was hemodynamically stable and thus instructed to swallow the SOS capsule. The external receiver indicated that no blood was detected by the capsule. The patient underwent an EGD 30 minutes later, and the capsule was visualized in the stomach. The EGD showed erosive gastropathy and non-bleeding duodenal ulcers with no bleeding or stigmata of recent bleeding. A follow-up abdominal X-ray performed 6 days later confirmed that the capsule has been excreted from the body. In conclusion, the SOS capsule is simple and easy to use without any learning curve required and is designed to provide results in real time. The overall investigation, from the capsule activation and ingestion until the result message is displayed, takes less than 10 minutes. The SOS capsule successfully detected the presence and absence of blood and was subsequently excreted in both cases.